Thanks for the question. So, I'm just going to caveat this video before I get into my spiel and let you know that I've never been in solely prior authorization. So, my role with prior authorization from a coder's perspective is to work with a prior authorization specialist to give them the codes that we may possibly bill out for a patient when their insurance requires them to get prior authorization for a procedure that is being done. On the billing side, I obtain prior authorization for certain insurance companies, especially for my mental health patient therapists, that maybe they're seeing a patient and their insurance company just requires that they get a prior authorization for certain CPT codes, certain procedure codes, or if they are going to do some type of some testing in the behavioral health clinic, then sometimes those tests require getting prior authorizations. Or if there are some type of limits for the patient's plan for their mental health visits. Say they have a limit of maybe 10 visits per year, and the patient will need 12, 13, 14 visits. Then I'll try to get prior authorization for additional visits for their mental health sessions. So that's the extent that I've worked in prior authorization. So I've never worked in a prior authorization position, like at a hospital or a clinic or a health system, but the nature of my job being a coder and a biller, I've worked in the prior authorization realm. Okay. But when you asked the question, I did do some research because I was curious. I was like, well, let me see if there is a school out there. And I wish before I hopped on this video that I looked at some job boards, because as I was thinking about what I was going to say in this video, I was like, well, the advice that I would give to someone that's asking about this position is the same advice that I would give someone that's asking about getting into medical coding and billing. First things first is to check the job market out there. So when you go on the job boards or, looking at the job postings, search up prior authorizations, search up uh, pre-auth and things like that to see if there are positions out there available, first and foremost, in your area and worldwide, and then see what the requirements are, especially since you're specifically wanting to get on the inpatient side. My hunch is that you don't necessarily need to be credentialed to be an inpatient prior authorization specialist. You just need an opportunity, especially because you already have experience and you're not credentialed. Like, so that you went into the world and you had held positions that allowed you to, do prior authorizations, allowed you to be a scheduling coordinator. So without a credential. So my hunch is to do that inpatient, you don't need a credential, you just need an opportunity. But with that said, in our world, there is a credential for everything. Just like medical billing don't necessarily need a credential, but there is a medical billing credential that you can get to help to make you stand out in this space, to help to make you show that you're a professional, to show that you went to school and you dedicated yourself to become a biller, and you've learned skills and you had extensive knowledge in billing that maybe someone that just kind of got on the job knowledge wasn't privy to. So the credential definitely makes you stand out. It definitely shows that you're a professional in your arena. And so I would never knock getting the credential if it's worth it. When you research getting the credential for prior authorization, make sure that you will get a return on your investment. When I researched out here, one school that I landed upon is called priorauthtraining.org. That's the website. The school is ACMA, and their prior authorization program is over $1,100. And so, what I'm trying to get at is See if that $1,100 will give you a good return on your investment. You want to be able to recoup some of that money back, and with the position that you get, with the pay per hour that you'll be getting once you get certified. Will this certification help you secure a job? Will this certification help you to negotiate a salary? Will this certification help to increase your knowledge in this area? So consider some of those questions. But take a look at this website and research it, see if it's worth your while. If the job postings is telling you that they require you, or they suggest that you have a credential and prior authorization for inpatient, and they tell you the letters of the credential, Google those letters to see what schools come up that offer a credential for that position. This particular website is saying that they give you an official certification. It's not a certificate, it is a certification that they give you for prior authorization specialists. And so they let you know that do they do credential you. There are a couple of schools that I see out here. I just did a quick Google, and uh actually I only see one school out here that says they give you a prior authorization credential. um so yeah, it's that school, the prior auth, hold on, priorauthtraining.org is the only school that I see. It says it's rated number one reimbursement market access, and so do with that information what you may. They do say they help professionals. They help credential professionals in some notable companies such as Abbey, Aetna, CVS, Walgreens, Cardinal Health. So um, take a look and see if that's, like I said, if that's worth your while. Also, I would suggest you network with some people that that's in prior authorization. So if you, since you've held those positions before, check with maybe some old coworkers. If you are in a facility that also has an inpatient side, see if you can find some inpatient authorization specialists and ask them about their career journey. How did they get into that position? Were they required to get any specialized training? If you are working in a hospital or a clinic, talk to someone in leadership and ask them what do they recommend, that you how to navigate a career into prior authorization inpatient, to be a prior authorization inpatient specialist. So yeah, I would just suggest a ton of research before you go diving into getting an authorization and paying for an authorization. It wouldn't hurt, like I said, as long as the education is beneficial and is teaching you something that you didn't know, or helping you to get clarity on some things that may be fuzzy about how to gather the information for prior authorizations. Just make sure, like I say, that it's worth your while, worth your time, worth your effort. You're going to get a monetary return on your investment, as well as a return on your investment by way of knowledge and time. So I hope that helps. If you decide to go to priorauthtraining.org and you decide to enroll, if you don't mind, let me know how it turns out for you. I'd be curious to know if the school is reputable, and if it's worth you getting training in to help boost your career. So good luck with everything.